Hi, welcome to the Power of Policy. 10 tips for getting things done in public health. I know people are jumping on, but I want to start right away because we have a lot of ground to cover and want to make sure that we give everybody time for questions at the end of this. I really want to thank the de Beaumont Foundation, APHA, along with the Johns Hopkins Lerner Center for Public Health Advocacy for making this book happen and making this webinar happen. We're going to try to be really real here with you. I guess the best way to say it is we're going to share some of the secret sauce that we've learned from research, from out there and experience, and really from listening to thousands of people and their experiences and work that they've done. We want to bring some of the best insights, best practices into how your experience, your evidence can be part of informing and influencing the policymaking process. So I think it's critical that we get to meet our panel of truth tellers, the folks who know the good, the bad, and the ugly of getting good things to happen. Keshia, you're first up on my radar. You wanna introduce yourself?
Yes, of course, right as the ambulance is driving by my window. So thank you. Hi, everyone. I'm Keshia Pollack Porter. I have the great privilege and honor of being the Bloomberg Centennial Chair of the Department of Health Policy and Management at the Johns Hopkins Bloomberg School of Public Health. I bring to this conversation years of experience engaging with policymakers, particularly in the space of health equity and health in all policies, health impact assessments. Just excited to be here with all of you.
Great. Thanks, Keshia. And Katrina?
Hi, everyone. Katrina Forrest, echoing Keshia's excitement, incredibly proud and excited to be a part of this conversation. I'm one of the co-executive directors of an initiative called City Health. And like Keshia, I bring to this conversation over 10 years of experience working at the intersection of law, policy, and government. And so excited to dive in.
Thank you. We could put everybody into boxes. Keshia is a leader in academics work. Katrina is a lawyer, has been out in the field doing all kinds of things. And please, in the chat, you'll see everyone's bio. You could say I'm a practitioner, but the beauty of the three of us is I think we can take turns being any one of those boxes, and let's just blast away the boxes. There's so much experience. I think we wrote in the book that we have over 100 years in total, which is a little scary, but let's jump in. I think it's important if we're going to talk about policy engagement. One of the key elements is really, why is this a skill that is so important for everyone in the public health field? It's not just a few, not just leadership, it's really everyone. I don't know, Katrina, should I throw it over to you first?
Sure. I think about policy as being one of the most powerful tools to bring about transformative change, with the caveat that policy is a tool. And I think we all know that policy is only as effective as it is implemented. But when it comes to health, health is impacted by so many policies that are often not seen as health. I think about housing as health, transportation as health. We know the environment impacts and influences our health outcomes. And so I think if we can ensure that public health champions, public health practitioners have a voice and a seat at the table where all of those decisions about policy and health are being made, particularly where health may not be at the forefront of the discussion, we can also then ensure that we are adopting strong policies that benefit everyone.
Excellent. Keshia, I'm sure you've got some thoughts on this one.
Yeah, thanks, Shelley. I very much echo a lot of what Katrina said. And I'll add that from my perspective, when I reflect on policy, I see how some of the nation's greatest public health successes would not have been possible without policy change, right? We talk about this in the book. We lift up tobacco control policy as one example. And I'll share it on the flip side. We know that policies that have not been implemented well or have been moved forward from a place where it's been grounded in principles related to oppression and power imbalances and structural racism, we know that these policies have harmed health, right? So we can see policies that benefit and support health and also harm health. And they've exacerbated inequities. And I believe that if people have created policies, people can correct these policies. And we really can lean into a role and engage in the policy process, because I believe in the power of policy, as our webinar is called today, and the power of the people to help to improve policies. So engagement is so critical to help achieve that goal, that vision.
Right. This is good stuff. I mean, we come from the world of policy. We've seen that in the past, so many of the successes in public health have been through really important policy changes at the local, state, federal, international level. You mentioned tobacco. With Katrina, you worked for years in housing. We get it, but I think it's really important that when we say policy, we're not just talking about passing laws. And that is a point I think we want to echo frequently in this webinar and for all the participants. Policy, yes, is getting laws passed, good ones, dismantling the bad ones, but it's also working with agencies to get good rules and policies in place. It's about working with budgets. Many of us are in governmental or have been in governmental positions, influencing and informing policy decisions around how much money is funded, appropriated. Those are policy decisions. School boards are making policy decisions all the time that impact health. How we implement those rules and regs. Things like even enforcement. These are all policy applications. And so when we talk about engaging in policy, we want you to think broadly. It's not just engaging the law, but in fact, as Katrina said, sometimes it's the implementation that can be the hardest, and yet a place where public health can have the greatest impact.
Yeah. Shelley, and I just want to jump in and lift up that point, right? And if we aren't part of the voices at the decision-making table, who will be?
Yes.
Right? Like, I think it's so important that we remember that people who are focused on maintaining the status quo, who are happy with the inequities that we have in this country, who are benefiting from them, they're at the table. You know, I want to acknowledge, I don't know if people read, there was actually an article in the New York Times a couple of weeks ago looking at, it was called something like America's Under Attack Inside the Anti-DEI Crusade. And in that article, there were lots of egregious things. But one thing that stood out to me was so clear. It was mentioning how there was a concerted attack on public university systems and states where conservatives dominated the legislatures. And that's what the article talked about, how individuals were there, a policy campaign to actually attack DEI, and they were at the table. And the other voices were not there. And this had been years in the works of planning. And so again, I just lift up that example. I encourage you to read the article if you're interested, but just to say we have to be there, because people who are on the other side of policies that align with our values and strategies, they are there all the time.
I can't say hallelujah enough. You know, this. So it's why we wrote this book, because public health is a big field. There are a lot of us, but for many different reasons that we're not going to discuss today, we've kind of stepped away, and we think we can't, or we're afraid to, or we're not allowed to, or it will somehow make us bad scientists or bad researchers, when in fact policy is made in so many different places, and there are so many opportunities for all of us to be effective and important and engaging and being at that table that you're talking about, Keshia. It's why we wrote the book, but I think we may have spooked everyone away because of the title, Policy Engagement. Oh, holy cow, is that dry? Wait, look, if you were going to call this what it is, what would your title be? Come on the spot. What would it be?
Something about the messiness. I don't, messy, clean up on aisle 3, messiness of policy, something in there.
Come on, Katrina.
I don't know. I think about the climate that we're in. So maybe something like cutting through the noise, harnessing strategic policy engagement to drive change. I don't know.
I don't know. I had something because, we are talking about policy is power. So
Yes.
put on your power rings. Obviously, this is why we weren't in charge of titles. But if anyone in this, we've got about 700 people that have signed up. I actually think I'm told it's a little more. Put in the chat. You got a better title? Put it in because we all need to think about how we get the word out. So with that, actually, it would be a really good chance. This book, our bottom line is that we're regardless of the role that you're in public health, if you're a governmental official, and I know from the registration, we have a lot of local, we have a lot of federal agency officials. You're wondering, okay, how can I engage? This book is written to be a primer for everyone who's all the way from advanced advocacy organizations to I kind of am interested and like to see how I could do this and get in. I'd like to actually put up a poll for all of you to answer so that we can have a little bit better sense in helping tailor our conversation and some of the key issues that we hit upon. Let us know where you are in this policy engagement process. Is this something that you want to build in more to your work? You're trying to figure out how to get in, how to navigate your own workplace. Let us know. And we're going to keep diving in here into how we can help you come away after this webinar feeling a little bit more confident and having a beginning sense or strengthening some of your skills in effectively bringing policy engagement into your wheelhouse. We will be answering questions at the tail end here, so please submit any questions you have into the chat and they're getting curated for us. So the way we're going to dive into our top tips and kind of best practices is in the book that we wrote, Policy Engagement, or any other title you want to give it. We together kind of had 5 working principles, our guiding principles to help navigate how do you effectively move in this space. And you already, I think, Keshia, you kind of gave a clue on this one. Our first guiding principle was that policy making is messy. It's just, you hear some people call it sausage making, others have other names for it. Yeah, it's messy. Katrina, do you want to take it on and give, what does that mean? And does that scare us away or give us some clues?
I hope it does not scare us away. We talk about this a lot in the book, but policymaking is an iterative process. It is cyclical. There are often many fits and starts. I think the example we used in the book was T21, that first passed locally in 2003, did not become the law of the land until December 2019. You're talking about a sustained 16-year effort. That's rough. And throughout it, again, it's the fits and starts. And it's hard. I think the other uncomfortable truth about what makes the policymaking process messy is that it's dependent on things like values and politics and marketability and resources. All of those things legitimately impinge on the way policy is made. And that can make for an incredibly frustrating, annoying process. But I hope that our book helps people to know they should stay the course. Do not be deterred, irrespective of the messiness. It is so critical for our work that we stay in the game. No matter how tired we are, how frustrated we are, we just have to stay in it. And we have some tips about how to navigate the messiness. So I think with that, Shelley, I'm going to throw it back to you.
Boom, 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 boom. The drum beat. We have some tips. All right. Keshia, should I give you tip number 1? You want to lead with us?
Absolutely. In order to stay the course, we think it's critical that you know why you are engaged. What is your big public health goal that you're trying to solve? What is your vision for the issue? So tip number one.
I love that one. All right, I'm going to jump in. Tip number 2, be persistent. Just as Katrina was saying, it takes time. Laws typically take 3 years. First time you introduce it, it's going to take a while. You got to be persistent, but it's the rules and the regs. It's the implementation, the enforcement. That is sometimes even more important, that you stay involved, keep the faith, and keep working along.
Yeah, that gets an amen too.
Yes.
All right. Tip number 3, Katrina.
Tip number 3, be strategic. There are no permanent enemies or allies. This one, I think about being strategic in 3 buckets. Be strategic about the who, the what, and the how. The who do you want to champion your policy issue? Hopefully you've identified someone who has voted in alignment on your issue, someone that's not afraid to be out front on the issues, but be strategic about who you want to champion your policy objective. Be strategic about the what. As Keshia just said, what is it that you want? What is your policy objective? Is it legislation? Is it a budget allocation? Do you want to circumvent the legislative process entirely and go for a ballot or a referendum process? But be strategic about what it is that you want. And then be strategic about how. How are you going to drive toward your policy change? Is it through coalition building, testimony, direct one-on-one meetings? I think it's incredibly important to be strategic. The other thing is policymaking is like a boomerang. Things come back around, and folks who might have once been your allies, you may find that after a couple of years, when attitudes have shifted, new evidence has emerged, positions changed, that they're now in lockstep and aligned with you. So also make sure that if you are opposed, you're being strategic in that you can disagree without being disagreeable, because you may need those same folks again in the future.
Yeah, it's surprising. And to amplify that point, sometimes coming into an agency or a legislative office with someone who has been perceived as your issue's enemy, wow, can that get attention? But that's a little extra bonus tip. We'll save that for reading the book. And there are some good questions that are coming along about, how do you keep the energy if you're staying persistent and these are long slogs? We'll touch on that more in the question at the end, but I think a clue on that one is it's important as you're talking about strategy, Katrina, there are milestones.
Yeah.
And there can be some very important incremental steps to get you to that big picture. And that's why that main point you made, Keshia, of you got to know what it's all about. That's why it's our tip number 1, because we're going to keep coming back to that over and over, whether you're trying to figure out what's the right negotiation or what's the right first step. Knowing what it's all about, it's how you keep your North Star going.
Absolutely.
And then, yeah.
Especially when you're facing those headwinds, right, Shelley? Like when you're facing those barriers, knowing why are we doing this work? Because it's tiring, it's exhausting sometimes.
All right, it's where the heart matters. Heart matters here. So
the heart work, yeah.
That leads us to what we called our guiding principle 2, which was how you engage in the policymaking world is personal, and it gets back to something we were already talking about. Just on this participating webinar, we have all walks and stripes of people, different issues, different job locations, different ways of moving in the world. And I think it's really important to understand that engaging in the policymaking process, doing advocacy work, there are lots of different ways to do it. And all of these different ways matter. And we talk a lot about this in the book based on where are you? What's your comfort level? Do you see yourself, is it working and influencing your boss in a company or in a health agency? that, hey, this is why this budget issue should be important, or how you talk to maybe an agency peer in another, in housing, in transportation. There are a lot of different ways that it can be testifying, it could be writing comments, it could be working with an organization, it could be an internal memo. It really is important to think about what is your values, what is your comfort level, and what you think you can do, and maybe pushing that a little bit. So let's boil that down into some tips here. Keshia, I'll toss this one to you.
Yeah, thanks, Shelley. This is such a critical point. People always say, well, how do I engage? Well, our tip is that there's no wrong choice. Once you decide to engage, please know that all forms of engagement are needed. We need your voice, whether it's through, as Shelley said, written testimony, supporting an organization, going to your internal committee to help to push things forward. There is no wrong choice. All forms of engagement are needed. Let me turn to Katrina for our next tip.
Thank you for that, Keshia. So tip number 5 is pretty straightforward, but don't do things that you are uncomfortable doing. We've already talked about this, but this is a process filled with fits and starts, which means you're going to need energy and you're going to need stamina. When you are operating in a place of discomfort, you are drained of those things. And so you want to make sure that you are choosing the path that feels right and necessary and good to you, but don't do anything that is not aligned to your moral center.
Well, there's that North Star again. Thank you. I love that one. And it leads me, actually, we're going to drop in a second poll, which is, it's an open-ended one. We want to know what's your public health kind of issue area that you're dealing with. Now, it could be a topical area, it could be an actual policy that you're working on. It could be something that you want to be learning a certain skill, but you don't know where to go to. Let us know these things, because this is yes, it's a one-time webinar, but I don't want you to feel like one and done. All of us are constantly learning our policy engagement skills, our advocacy skills. One of the things with the Lerner Center for Public Health Advocacy, it's not some little hidden secret kept at Johns Hopkins. It's really designed to be here for the field, to really boost again, to build up our muscle in being effective, confident policy engagers. We're creating the resources that are going to help you. Let us know what you need, what you want. And this is one way to keep alive, that we can continue further conversations, further webinars based on what your needs and interests are. So let me keep marching along while that's out there. We have a third kind of overarching principle that we've been working with in this book, which is that your message should align with your target audience. Let's break that down and what that really means. And Keshia, I'm going to swing it over to you.
Yeah, this principle may seem very basic, and it is in some ways, right? Whoever you're speaking with, whether it's with a community group or an elected official or an agency director, it is so important to have a clear message that aligns with your target audience. Right. So what does that mean? Well, I think a few things that we all reflect on, and that's in the book, is that your message should be tailored to ensure that it resonates and can be received by the audience you're seeking to influence. So that might mean when you go talk to somebody about a particular issue, you might think about and do your homework and say, well, what might resonate with this person, right? I know that they, for example, have done a lot in child health. And so if I'm coming to talk about food policy, my message should bring in their work in child health. Understanding that message alignment really begins with the important work of listening to and understanding your target audience. I'm not saying agreeing with, I want to be really clear on that. It is understanding their perspective. How do they speak on the issues you care about? How do they frame those topics? What words do they use and what words do they avoid? Each audience will have a different view on the issue you care about and will require different information to make sense of, prioritize, and ultimately support your efforts. So again, this is such a key principle, very basic on the surface, but lots of questions and lots to unpack there to ensure you can be effective. In the book, we have some tips related to this. So let me go ahead and turn it to Katrina and ask, what's a tip related to this principle you want to lift up?
Yeah, the first tip I want to lift up is just to be your real, authentic self. I don't know about anybody else, but I think this is just good life advice. But in the context of your messaging, I think too often we attempt to contort ourselves, we overthink, we overanalyze our messages in ways that are often more harmful than they are helpful. So just be your real, authentic self. I have two quick anecdotes. When I started at City Health, which is the organization that I co-lead, I was meeting a lot with public health commissioners, public health directors, and it was my first time in public health. And I became sort of the living encapsulation of doing too much because I was nervous, I had anxiety, and I'm like, I don't know, I want to impress these people. And I just wasn't leaning in the truth of my own knowledge and expertise. And so now I can go to folks and say, I am in public health, I am not of public health, but I know policy. I've had the benefit of working at every level of policy. And I can lean on that. And so again, it's just about showing up authentically as yourself. That said, there are times that you're going to need to approach conversations with sensitivity. And I don't think you need to sacrifice authenticity to be sensitive to your audience. Keshia, you've just said a lot of this. It requires active listening. How are people talking about your issue? And can you parrot back your messages utilizing the framework that they've just put forward? That is so critical. But again, it's all about being yourself. Be real, be honest. And with that, I'll pass it to Shelley for tip number 2 on this topic.
Oh, thank you. I love you guys. This is good. This is good conversation and super real. And I want to get you your honorary public health degree, Katrina. Tip number 7 from us, and this is consistent. I think you were starting to touch on this, Katrina. The thing we have, we don't have piles of political donations to give. And, while we are doing work that is in the public interest, we're not really organized to take advantage as much as we should, and we can change that. But the power of the people, that is something public health has to work on. But what we have, all of us, every single person in this webinar and around us, our field, our work, our research, our experiences, our community engagement, we have credibility, and that is our most sacred asset. Don't ever think that, and this is part of being real and part of that North Star, if you don't know something, say you don't know it. I find that actually the most powerful way to have people believe you is just be honest about what you do know and what you don't know. And when you don't know, you'll go and investigate and you'll come back with them.
Yeah.
But stick with the evidence, the facts, the knowledge that you have, that you feel confident about, and represent and present that. And part of it is our job is to bring science, evidence, and the public health information back into the policymaking process. So your credibility, your credibility really is the thing you must protect the most. All right. Whew. Well, now with that, after all these, light breezy topics, we got our fourth overarching principle. And that leads us, it's actually a great juxtaposition. Advocacy, policy engagement isn't necessarily lobbying. And lobbying is not a dirty word. It's something that we have as the boogeyman out there in our field, but it's really important to get it what it is so that we don't say, oh, no, I can't do this. And I got to turn to my favorite lawyer, Katrina Forrest.
Shelley, you've already teed this up, and I don't know exactly who said it, but the quote is, all lobbying is advocacy, but not all advocacy is lobbying. And I think that is so critical to say at the outset, because in fact, most of the advocacy engagement that you're going to do is educational in nature. We talk about this a lot in the book, but even if your activities do rise to the level of lobbying, you should not fear it, because most organizations are legally allowed to lobby. And as a private citizen, it is your right to do it. I'm not going to belabor this too much, but I do want to make the distinction between lobbying and advocacy. And the crux of it really comes down to intent. The intent of lobbying is to influence an outcome. It is often to influence a specific piece of legislation. With advocacy, the intent is often to amplify or educate an issue. And so I think that it's really important to make that very clear. There is no limit on the amount of non-lobbying advocacy that you can do. In the book, we talk about all the different ways that you can educate, you can testify. There's so many things in the universe of advocacy that you can do, and we don't want people to be deterred.
Okay. So maybe it would make sense, since you were on a roll, our dear lawyer, to do the tips too.
Sure. So the first tip is know lobbying rules as you engage. Lobbying fears are not a reason to avoid engaging. Most of what you will do will not qualify as lobbying, and it won't put you in harm's way. I've just talked about this, but just to give you a few general rules, ideas, every jurisdiction has slightly different lobbying laws and regulations. So if you are preparing to lobby, just make sure that you educate yourself and you are grounded in the state and local lobbying laws. As I mentioned before, generally speaking, lobbying is any attempt to influence a specific piece of legislation. We go into this in the book, but it's the distinction between direct lobbying and grassroots lobbying. On grassroots lobbying, that is about kind of galvanizing the general public and urging them to contact a specific legislator on a specific piece of legislation. Direct lobbying, again, is about directly communicating with a legislator or their staff on a specific piece of legislation. So again, before you even get into the universe of lobbying, there is so much that you can do in the space of advocacy. And I don't want us to lose that thread, because I do know, particularly for those in governmental public health, there are limitations on what you can do. But again, advocacy gives you a lot of cover, and there's so much that you can do that is not lobbying.
Great. That's super helpful. And in our resource section, again, there was a link in the chat. There's also the QR code out there. The Lerner Center has a number of links to places to get more and more information in the lobbying arena. I know that a variety of groups have some good information. One of my favorites is Change Lab Solutions, has some great overviews that we have in there that we can link you to. So absolutely something to pay attention to. I feel obligated, because we have literally hundreds of the participants in the webinar are coming from local, state, and federal agencies. They're governmental workers. And I know this is an area of public health where often they think, okay, I can't, how can I engage in policy? Isn't this going to be lobbying? And I get federal money. I'm specifically told I can't do it. And I go back to my own story of how I first got into, I was trained as a toxicologist, as an environmental scientist. And I was working for New Jersey's Department of Environmental Protection. I mean, I was the definition of a public health person in local government. And I got tapped. I wasn't anything fancy. It was not a bureau chief or department. You know, I was the person cranking out risk assessments on hazardous waste sites. Beginning intro job. And because of my APHA membership, I was asked by the association to come and testify before Congress, because there was an effort to dismantle the laws that I actually was funding my position, the work I was doing. I testified before Congress. It wasn't lobbying. I was there by invitation. I was there as a resource, as an expert. Yes, I was fully funded under federal dollars. I was a state employee, but because of the role and the fact that I was asked by Congress through APHA to do that, it's not lobbying. This is educational. Now, there are so many other things that you can do that don't even get that close, but it's just, again, to highlight, know your information, and know there are many ways to get involved and be a participant.
Yeah. And Shelley, maybe I could jump in and just share too. And if we don't know, ask.
Yeah.
You know, I here at Hopkins, we have our Office of Government Affairs, and we engage with those individuals, and they're at the local, state, federal level, and just ask. We really encourage you to don't immediately think, oh, I can't do that, I'm not allowed. As Katrina said, there are some restrictions, but certainly engage with the people who can inform you about what you can and cannot do.
Absolutely. Absolutely. And that is a perfect lead in to our kind of fifth overarching principle, which is policymaking takes a village. You were on
Yes.
a roll, Keshia, so keep going.
Yeah, thanks. Thank you. Yes, look at, we are a village here. We're a village, all
Yes.
of us on this webinar together. This is such a key principle. They're all important, and this one is important as well. You don't have to do this work alone. Find your people and build and nurture those relationships. You don't have to be a lone ranger to do this work. You know, you can be more powerful, effective, and helpful in the bigger picture by focusing on your goal and working with organizations, community members, and leaders engaged in the issue. You know, look to see who are those people who have a stake in the issue. Who can you connect with? I think about so many issues that I've been able to engage with in the policy space, and I'm not alone, especially because none of us knows it all, right? Let's be humble here. There's a lot I don't know. And so I can tap into partners and other individuals who can bring another perspective or lens, and we can go and journey to advance policies together. And so what this means for us, and I think we've all had examples like this where we engage with other researchers and experts, we engage with advocates, we engage with people on the ground who have those direct experiences that will be impacted and are important for that policy issue we're talking about. Because I believe that when we don't, there is potential for harm. Right? The unintended consequences can happen when we try to do it alone. We try to think we know how to do everything, right? And I think we can look and see that there's so many reasons out there, so many policies out there that have been harmful and have been implemented and adopted. And if we had just engaged people, that perhaps we wouldn't have that much harmful policies out there, right? So that's just one thing we wanted to lift up. And again, this is so important. And we have a few tips we want to share. So I'll turn to Katrina to share this first one related to this important principle.
Yeah, thank you, Keshia. So the first tip here is just to find organizations that are known to be effective in the policymaking arena and align your efforts. We say this in the book. It's an old proverb. If you want to go fast, go alone. If you want to go far, go together. And I think this speaks to that. There is no need to reinvent the wheel. I can speak specifically about my work at City Health. We advanced 12 policies in the nation's largest 75 cities. There is no way any single person on our team could be a subject matter expert in all 12 policies. And for that reason, we partner. We partner with highly credible, highly reputed national experts who have subject matter expertise in each of our policies. And we also partner with people who are really good at get policy over the finish line. And so it's kind of a virtuous cycle for us. We are providing direct assistance to city officials, but also strategizing on, okay, now that they have the policy, how do we get it adopted? But that would not be possible without the partnership. So I just want to highlight, find folks who are doing this work, align your efforts. You don't need to reinvent the wheel.
Yeah, that's so critical, and thank you. And I think the next tip really builds on this, and in terms of the people to engage with, your policymakers are critical and be a resource. Katrina just talked about that in her work. I know I can reflect on the work that I've been doing and the relationships I've built with policymakers, where I'll have people call me or text me and say, hey, I need to talk to you about this particular topic. And being responsive to that is critical. Or as a researcher, I've certainly engaged with policymakers to say, am I asking the right questions that can help you when it's time to actually move forward, right? Or it might be, let's take the findings from our work and translate it and disseminate it, communicate it clearly through policy briefs or infographics or other types of communication channels, right? We have to remember too, policymakers, legislators, business leaders who are leading policies within their organizations where we work, all of these individuals, we can influence them. We can share information with them. We can engage with them, and we can be a resource. So I put myself out there multiple times with various policymakers to be a resource, and some of them call and follow up and some don't. And I acknowledge that, and that's okay. And so for the ones that reach out, I will answer every time, because to that earlier point about credibility, we have to also be responsive. I can't say I'm here as a resource and then they call and they say, oh, I'm too busy, I can't help you, right? And I think that that's also really important. And I think we all have experiences like that where we've answered the call, the literal call, when it's come to help and provide some assistance on an issue. So thanks, Shelley, for that, allowing us to really unpack that really important principle.
Well, this is getting back. We fed off of each other, and I've been inspired by each of you in helping translate and put this into action. And I think part of also why we wrote this book is recognizing, yes, policymaking is messy. It can take a long time. It can take a lot of challenges. And I've seen a few questions that are already popping up, and we're gonna transition over to those questions. But a lot of them are about how do you keep the energy? How do you prevent burnout? And in part, why we did this translation into a book was I'm inspired by what you all do. I'm inspired by the many people that worked with and the wins we've had. There've been some rough losses too, and how you learned from those. But the book was written to be an inspiration to our field, and how to, again, feel that heart and that love and that fortitude for doing some of this hard work, because it does make such a big difference. And that's the key thing of finding the right ways to do it based on where you are, what you care about, where your passion is, and how you keep that alive. So I'm pausing for a second because I don't know, Katrina. I'm gonna throw this over to you in terms of, I love it. You've said you're in but not of public is of public health. Yeah. So why'd you do this with us?
I love policy. I think I've devoted the vast majority of my career to working on policy. I have seen really effective policies change lives in real time. I'm also a deep lover of local government. I spent 6 years in DC government. I spent 4 years with the city of Chicago. I love it. And I think it is so critical to understand the mechanics of how it works, and also to make sure that we are equipping public health with the tools to engage in the space, because literally health is everything. Every policy that you can think of, there is probably a health component to it. And if we are not at the table, if we are not having those conversations, we are not going to be able to help and protect and support the folks that most need it. And so that's the reason that I wanted to join the two of you. Also, like, y'all are rock stars and I wanted to learn from you. So selfishly, I had a reason to. But broadly, I mean, I think it's so critical that folks understand how to engage in the policy space, because it does shape our entire lives.
Mm-hmm. Well, you're a rock star too, and we were so excited that you joined our team. It's really Shelley. She wore me down in terms of asking to join her. So I'm like, sure, of course, Shelley.
Persistence. What did I say? Persistence.
Persistence.
What my favorite story, and then we're going to go right into questions, is the two of you were doing a book signing. And I think, Katrina, I think you told me this story of the fellow who showed up to get your signatures. Well, you tell this story.
It was
You know
honestly
what
a
I'm talking about.
beautiful moment. I want to give Keshia space to reflect on it as well, because it has really stuck with me. But he came up, he asked for our autograph or autograph. Look at me, guys. I'm Hollywood now. He
Yeah,
asked for our
it was autographed. It was.
and he said this book was his Bible. He had pages dog-eared. He had systematically highlighted different sections. I mean, it was so incredible. And I hope that the value he got from this is something that resonates and other people are able to learn from and get something from it as well. But that moment blew me away. I don't know, Keshia, if you've been reflecting on that as well.
Yes, it was great to be there with you for that book signing at APH. It was at the most recent APHA conference, and it just warmed my heart. You know, when we did this, so many people before we wrote this book, I had been in so many spaces where people would say, like, how do you do policy? Like, how do you do it? Like, I want to do it and I don't know where the resources are. And I think we felt this need to respond to that ask. And you know, I think all of us hope and believe that this book can inspire you all to get engaged, to be involved. And I don't think that this is, you know, I think we all believe too we can change the world. And if we couldn't, I don't think we would be here. I don't know many people in public health who don't believe that they can change the world. And like Katrina, I love policy. I sort of fell into the policy space when I was in grad school, and I am so happy I'm in this space. And I really feel like we can change the world. We can improve policies. We can help to achieve the vision for a more equitable, healthier world. And it's possible through policy. And it's messy and tiring, and we have to stay persistent. But we have our people. Find your people, and we can make it happen.
All right. Thank you, guys.
Thank you.
And this is part of a essential skills book series based on surveys, extensive surveys of the public health workforce. And this area of policy engagement was identified as a critical skill, yet one that most people in public health didn't have. And that's why it was put together. All right, so I'm going to go through, our team here has been pulling out questions. We're going to go in order that we've been receiving them. Let me read them, and then we'll jump in. How do you make the call about whether it is better to negotiate or stand your ground on an issue? And any tips for negotiating effectively? Let me take a first stab, and then we'll kind of keep going on this. I want to suggest to all of you, going back to those guiding principles that we were talking about, as a way to help anchor on how do you deal with so much of the policy engagement area. One, we said policy making is messy. We said, know what your big picture goals are about, what, why are you there and in this space? And the third was, we said it takes a village, or, have a group. And negotiating is standard operating practice in the messy, crazy policymaking arena. And it's why you need to know what you're in there about, what's the big issue, what are your bottom lines, what you care about. And it's not just you solo of what you think is right. This gets back to that village, and why it's another reason it's so important to work in coalition with people who are experiencing the public health problem on the ground, the local organizations that are dealing with it, the think tanks, academics. You gotta, ideally, you'll have calculated and figure out your bottom line policy positions before you get involved, or understand what are the absolute core deal-breaking issues. And you got to stick together. It is one of the thing that I have seen over the years that's most heartbreaking is when someone breaks out of their coalition and thinks, okay, I'm going to go make the deal with the legislator or the agency, and I think that's the right thing to do. So one goes out, they may be high profile, and so they give them the cover to go ahead with that law, that policy, and the entire coalition is left hanging. And you want to talk about destroying, and often you may be missing a critical aspect of that policy, or you've broken forever your relationship with that coalition. Those short-term gains are not worth the long-term impact. So we don't go into the details of negotiation in this primer. This is an intro to some of the concepts, but it is something where you've got to stick with some of those core principles. I know we could all jump into that one. I'm going to keep going because we've got so many questions up here. Thank you for your practical engaging book on page 72. I don't memorize. Maybe one of you, there are tips on interacting with policymakers. For people new to policy engagement and who fear some possible confrontation, can you share more about the tip of countering your opposition?
I'm happy to kind of kick us off on that one. I think the biggest thing there, tenet to keep in mind, is preparation. We talk about this in the book, but when you're engaging in the policymaking process, it is so important to understand the waters in which you're swimming. And this kind of goes back to knowing who are your allies, who are your supporters, who is the opposition, and to that point, what are your opposition's objections to the policy, and making sure that you are doing research to understand how to best counter their arguments. So I can give you a real world example. I've worked on paid sick leave, paid family leave policies, and often the opposition was saying, this is going to be detrimental to the business sector. This is going to be detrimental for economic prosperity. Okay, those are your arguments. You're saying businesses will close, workforces will shrink, wages will go down. Is there any evidence to counter that? And then doing your homework to figure out, what has this been evaluated? In fact, it has. The city of Seattle, they passed earned sick leave 3 years after the policy was implemented. They conducted a really comprehensive study that just completely undid all of the arguments that were on the table. So that's what this is really about. You want to make sure you know what your opposition is saying, what their arguments are, and then making sure you're doing your homework, finding the research, identifying the evidence that is a perfect counter to exactly what they are stating, and making sure that you can respond to questions about that.
Yeah.
Thank you, Katrina. I'm gonna, Keshia, I'm gonna throw this one to you, because it actually touches on a number of similar questions. As someone who's in the research sector of public sector, how could you pivot into policy work or incorporate more policy work into clinical research?
Yeah, I love the question. You know, a lot of people don't know my master's degree is in epidemiology, and I came into policy wanting to do more of that policy work. And I would share that there are a number of ways as a researcher to engage in the policy process. One is, are we asking policy relevant questions, right? Are we generating evidence that can help to inform the policymakers, right? So that's one thing. You might say, well, how do I even do that? One is just being aware of, if you don't have a chance to actually have a conversation with people who are connected to that policymaker, reading their site, their platform, looking to see evidence or questions that you can ask that could help to inform the issues you care about. Evaluating policies that exist, as Katrina's example just showed us, having that evidence is so critical. Right? Understanding, studying implementation, studying policy change, that's critical for us. And then finally, for those of you who are in more clinical sciences, policy's there as well. Shelley started this early on by saying, we're not just talking about legislation, but regulatory policy affects so much of what clinical medicine and clinical research does. There are policy implications there and ways to engage in that work and to inform regulations, for example, that connects to that clinical research.
Thank you, Keshia. I'm going to try to do a little combining. one of the questions is, do you have advice for dealing with policymakers who are anti-science / anti-facts?
Mm.
And another question of similar vein, what advice would you give when the political / economic environment is challenging to convince policymakers, non-health ones, on public health policy reforms? I.e., when is it hard to prove cost effectiveness of a certain decision, and or when the social norms are against the change that is needed?
I can kick us off on the first question about engaging with policymakers that are anti-science, and this is probably going to be a wholly unsatisfactory response, but it picks up on a lot of what we've said today. Find your people, identify your champions. The reality is you're not going to be able to change everyone's hearts and minds, and so it's really important that you are organizing around and working with people that are like-minded. Because again, I think just an unfortunate truth and reality is you're not going to change everybody's mind. If folks are arguing about objective fact, that is very difficult to work around. I've seen people try to lean on values. And if we have shared values, how can we get at that without leaning so heavily into the evidence? It becomes a lot more about storytelling and less reliant on the science. I think are some ways to combat it. But I also just want to say, I think it's important to know you're not going to necessarily change everybody's mind, and that's okay. That is not failure.
Yeah. And maybe, Shelley, can I jump in on the second part of that question, which is, we have a section in the book that talks about some of these tools that can help with these non-health policies. How do we lift up the health impact? So we mentioned like health impact assessments or legislative health notes or racial equity impact assessments. So there are tools out there. Read more about them. Contact us if you have questions that can help to bring and amplify those health and equity considerations when they're not at the forefront of the bill, but we know that they clearly exist.
I'm going to add to this also, but I want to have our final wrap-up poll introduced because I think it's helpful in all of these efforts. What are you going to do? We've had some important conversations on how you can get engaged. Hopefully this has been helpful to you in thinking about what might be appropriate, whether you're getting engaged or fine-tuning some of your advocacy skills. Please let us know what you're thinking about. I want to kind of do a combination with the two of you. In part, there's the gray hair thing. I have run into a number of issues where my science was of no use. And I was engaging with organizations that I perceived in opposition. But it's been amazing how sometimes you get in this combination of facts with values, and you can find a way to get to different audiences in different routes. This is about, we always have to be creative and thinking outside the box. I think we started that way of none of us can be put in a box and none of you should stay in a box. Many years ago when I was with the Pew Charitable Trust, we got engaged with credit card reform because we saw that actually as a public health issue, the predatory practices. But members of Congress laughed us away and essentially said, no one's making you have a credit card. Just go, if you go find another company. Well, we did an analysis of every single credit card on the market so that we guaranteed that we were going to find the cards that members of Congress had themselves. And we were able to show that their card and their wallet had practices that the Department of Treasury, Federal Reserve actually would describe as unfair and deceptive. It changed the game. It all of a sudden made it something that was impacting them, or if you can find a way that's impacting a constituency that they seem to be more focused on, or finding constituents who they listen to, like American Academy of Pediatrics knows who the pediatricians are to members of Congress, grandchildren, or their own kids. There are avenues to find ways to get facts in, sometimes having a different messenger or having a different venue. So there are ways to do it. And I think that's where the wrap up we're going to do here, because we are at that final hour. More to come. This has been Keshia, Katrina, not only a joy in writing this book with you, but this was great. Thank you everyone for your engagement and participation, and stay with us. Tell us how we can continue to be helpful, the kinds of things you're interested in hearing and needing. We want to be a resource for the public health field. We need all of you to be engaged, and we need you to tell us how to help you get there. So with that, thank you very much to Lerner Center team and staff, Keshia, Katrina, always lovely.
And thank you, Shelley.
Thanks
Thanks,
so much,
everyone.
Shelley.
Take care. Stay well.